We have Ryan Barker here, who's the Executive Director of Squishy Face Crew in Fredericksburg. And I'm going to let him introduce himself and tell you a little bit more about what he does and how he's dealing with the parvo situation.
Great. Let's see. All right, hey everybody. Thank you so much for being here and thank you for having me. Like she said, my name is Ryan Barker. I am the Executive Director here at SFC Virginia Animal Rescue, or the Squishy Face Crew. And I was asked to speak about my very favorite topic, which is parvovirus. As a rescue, we have been treating parvovirus in earnest for the last 5 years of operation. I think we've gotten pretty good at it, and we've certainly learned a lot along the way, which I am very happy to be able to share with all of you guys. So what we've done here today is kind of break down the information that we have into 4 different protocols that are based on varying levels of access to vet care and available resources. So whether you're a very, very small rescue, foster-based rescue with like no budget at all and no access to vet care, or a large shelter with a full medical team, hopefully there's going to be something in here that's relevant and interesting for you. My presentation here does run right around an hour. So if you can help me out and hold any questions till the end so I don't get off topic and distracted, I would very much appreciate that. I'll just go ahead and get started, I guess. Let's see if I can share the screen. That work? Yes?
Yeah.
Cool. All right, so this is called Parvovirus Protocols to Save More Lives. All right, just a little bit more about us and what we do. We are the Squishy Face Crew, as I mentioned. We are a foster-based rescue in the Spotsylvania area of Virginia. And the vast majority of the animals that we take in are from rescues and shelters in southern and southwest Virginia. We are fairly high volume for being a foster-based rescue. We're impacting around 2,000 animals every year at this point in time. And we are intentionally low barrier in everything that we do. So our adoption process is low barrier, foster program is low barrier, and our intake decisions are low barrier. So we don't require any sort of specific vetting or quarantine time before we bring an animal into our rescue. And as a result, we are opening ourselves up to a greater risk of taking in animals that are either already sick or have been exposed to illness and are probably going to become sick in the first week that we have them. So we've seen a lot of parvovirus. That's just kind of how it goes. I estimate that in the last few years, we have treated between 200 and 300 cases of parvovirus. Unfortunately, in the first couple of years that we were doing this, I didn't keep very good records of how many animals we treated, so I don't have a specific number. But I can tell you that this year to date, we have treated 65 canines with parvovirus, which is an average of 2.5 every single week. I do it all myself for the most part. So there's essentially been no day in 2024 that I have not been treating at least one puppy with parvo. And we do intentionally take in cases of parvo from other shelters and rescues. Of course, we just sometimes get it by accident. We don't know that it's coming. But for the most part, the cases that we are bringing in, we've been specifically asked to take in and treat. Just a little bit more about us. I'm not going to expand too much on our numbers just because it's not super relevant, but here's why you should care what I have to say about parvo. Other than we just do it a lot. We do have a pretty good success rate. So our success rate ranges between 85 and 95%. On the higher end are going to be animals that break with parvo in our care. Because we are able to more rapidly assess the situation and identify the signs, whether they're here on site at our HQ or in one of our foster homes, and then get treatment started ASAP. For the ones that we transfer in, very frequently, they're coming in 2, 3, sometimes even 4 days into their illness. And of course, the further into the illness that they are, the less the chance of success. So that's going to be that sort of 85% chance of success rate for the ones that we're bringing in. So many of the canines that we've received this year with parvo have come in very bad shape on arrival. So I would describe it as critical condition. Of the 9 puppies that we've had die so far in 2024, 5 of those actually died within the first 24 hours. Last week, I had 1 die within 3 hours of arrival. So at that point, there's just really not a whole lot that I can do for them. In terms of cost, because everybody cares about cost, we do everything in-house. So we do not go to an outside vet clinic for really anything at all, and especially not for parvo. Our average cost for medications for your typical puppy, 10 pounds or less, is going to be between $250 and $300. So for those of you who are using, vet clinics, local vet clinics, or emergency vets, you're probably looking at, price tag at closer to $5,000 per puppy, which is super unsustainable for rescues, especially if you're trying to treat a whole litter of puppies. So we love our cost for what it is. $250, $300 really can't be beat. In terms of protocols, as we get into it, just understand that there's no one size fits all approach. Since we've seen parvo so much, we feel comfortable flexing our protocols depending on how the animal is responding to the various medications that we're trying, and just the overall course of the illness. But if you've never treated parvo, of course, you should, be more to the letter of whatever protocol it is that you're following. In this, we're going to talk about space setup and supplies. I'm going to start there because it's very important. And then, as I mentioned, we'll go through kind of 4 methods of treatment that are based on those varying levels of access to vet care and resources. And just my nice disclaimer, I'm not a veterinarian. All the protocols that we are going to talk about that we use have been approved for use by us, by our supervising vet, Dr. Ntoku. And if you adapt any of these for use at your own shelter, please consult your medical team if you have one. It's not specific veterinary advice. All right, setup and supplies. We're going to start with this because I wish that somebody had spent more time talking with me about the importance of a good setup and all the supplies that I was going to need before I started doing parvo in volume. We've made a lot of mistakes early on with setup, and they really impacted our success rate and the quality of life that those animals had during and after treatment and whether they survived at all. Having a proper setup and all the supplies that you're going to need on hand before you really even start treating is very critical to containing the spread of the illness and also just treatment in general. So I've kind of made a list of the supplies that I keep in our parvovirus room. So we do have a specific room on site at our HQ that exists only to treat parvovirus, and I keep all of these things in there standard, and I make sure that it is stocked and restocked after each group. Obviously, everybody's list is going to be a little different depending on what you're doing, but just to give you an idea, housing, think about how you're going to house those animals. Are you going to use crates or cage banks? You will need more syringes than you ever thought possible. 1 ml syringes are what I use the most of, both oral and needle. You also need some kind of needle for fluids. PPE gear, we use the yellow gowns, gloves. I have a specific pair of flip-flops that I wear in my parvo room. I just take off my street shoes before I even walk in there. If you don't have that option, you can grab those little blue booty shoe coverings, and those also work fine. We have a bunch of cleaning supplies that just kind of live in that room, a trash can, extra bags. At one point, we were using pee pads for, lining the cage banks while we were working. Now we use throwaway linens, so we just have volunteers cut sheets down, both fitted and regular, to cage bank size, and I just use them as one and done, so I just throw them away after each time that they're soiled, or every 6 hours or so when I go in there. It was I love that we started doing that. We were wasting a lot of supplies when we were using the pee pads, and our fosters need those. Bowls for food and water, make sure you're using stainless steel. I use regular water bowls, but for food, I like to use the cat saucers just so there's nothing in the way of the puppies being able to see the food and smell the food, etc. You will need multiple food options, dry puppy food, a couple of different types of canned wet food. Stinky wet cat food is good to have on hand. Gerber beef baby food is what I find works the best for puppies, and then a variety of treats and chews. Some sort of water source, a dish bin, sharps container, scissors, larger oral syringes, and that's for syringe feeding. I don't use larger than 5 ml for syringe feeding. For cleaning supplies in our parvo room, we use Rescue and Parvosol. I actually prefer Parvosol. I think it smells better and it gets debris up a little bit better than the Rescue does if you let it sit for a minute or two. So many paper towels. We have like I mentioned, a specific broom, dustpan, mop bucket, etc. that lives in that room. Caro syrup we use in every protocol, so I just keep a bottle of it down there. A microwave is nice to have. It's not super necessary, but I use it to warm up the baby food and slurry that we're syringe feeding. A mini fridge or easy access to a refrigerator is important. If you're using one of the protocols that calls for refrigerated medications, you're going to need those within arm's reach. And then some way to keep track of what you've done for each puppy, whether that's a medication chart or a note sheet, especially if you have multiple people or different shifts that are coming in to treat the puppies. For us, it's just me, and I can pretty much keep it in my head for about 5 days. But if it goes past 5 days, I've totally lost track of what I've given. So using a note sheet is very important. So, as you're doing this, you need to make a list of what you need in your space to be able to both treat and quarantine. Doesn't matter what protocol you're using, and just make sure that you're set up ahead of time. In terms of space setup, so we made tons of mistakes with space setup when we first started. We just made mistakes in general with Parvo when we first started. I think everybody does. And a lot of these mistakes were related to improper quarantine and separation of litter mates, and just not containing the animals in a way that was going to keep Parvo in one space. So when we started this rescue, we started it in my very normal house on a cul-de-sac in Fredericksburg, which was not purchased with any intention to house an animal rescue in it. So when we first started getting Parvo, we didn't really have a designated place to treat. So we ended up using my master bedroom, and I moved to the guest bedroom because that's just who I am as a person. And we put 2 playpens in the master bedroom. So if we had one member of a litter test positive for Parvo, we bring the whole litter back. We put the ones that were feeling pretty good together in one playpen, and ones that were feeling badly in the other playpen. And they were all in the same room. I mean, major issues with this are going to be, that you're very easy to cross-contaminate between the groups. Some of those puppies may never have broken with Parvo at all, because not every animal in the litter is going to break with Parvo, even if one does. But now that they've been next to each other in direct contact all this time, the chances are just increasing every day that they're next to each other. Sheets and tarps that we were using to line the floor. Puppies that are feeling well, of course, are going to, paw up the sheets and the tarps. We destroyed those floors so quickly. And anyway, it was just a bad setup overall. Once we realized that it was a bad setup and my floors had been annihilated to the point where I needed to completely redo them, we moved our Parvo treatment area into a bathroom. So it was a bathroom that literally existed just to do Parvo. Which it was better for cleaning purposes. You can bleach a bathroom much easier than you can bleach a whole master bedroom. But we still weren't really using cage banks or anything to keep them contained beyond just, contained in the room. And so if, for example, they have a diarrhea blowout right by the door, you're opening and closing that door, it's going to hit that diarrhea blowout, contamination issue. And as puppies start to feel better, they're running around in that bathroom. They also like to chew things like water supply lines to toilets. Not a good experience for anybody. So again, this is not a good setup, and I'm just kind of showing you what not to do here. So I do not recommend either of these setups if you can avoid it. It's how we started, and it is what it is at this point, but we learned from it. Once we kind of grew as a rescue, we ended up moving away from that house. We moved to a 5-acre property, which has my major residence. And then down below it, there's a basement that we subdivided in half. So half of it became large dog kennel space, and the other half became 2 medical quarantine areas. And one of those rooms is designed just to treat Parvo. That's our Parvo room. And the other one is just a kind of whatever else we need to quarantine type of room. So sometimes we have ringworm in there, sometimes kennel cough, etc. And while we were building out the Parvo room and getting all the supplies for it, we had this sort of interim Parvo treatment setup, which I think is probably the best recommendation I have for groups that don't need a large volume Parvo room. I mean, I think that's very specific to us. And what we had was a single cage bank. 2 cage banks would have been better, but we had a single cage bank to start. A wire crate kind of next to it to move the puppy into when we were cleaning. We had a folding table that just sort of held all of our supplies. There's a mini fridge in this room. You can't really see it on this picture. And then we, we're hanging fluid bags from the ceiling. So this is a pretty portable, good temporary solution that would work for groups that are really only treating like one puppy at a time or a couple of puppies here and there, et cetera. If you don't have a cage bank, they are pretty easy to find on Facebook. There's a couple of veterinary swap groups that I get equipment from frequently for not that much money. And you can also frequently find them from large shelters that are either downsizing or switching to new equipment. We found a lot of our initial equipment that way. Ideally, you only want one puppy per cage. As I mentioned, it's a bad idea to co-house litter mates that you're treating for parvovirus. If you can help it, just one pup per cage. If you can't do that for space reasons, even me last week, I had 9 puppies that I was treating for parvo last week, and we only have 6 cage banks. So I had to co-house very briefly for a couple of days. And the way that you make those decisions is based on how sick they are. So I will typically put like 2 puppies that are feeling quite well together, or, you know, at least like at the same level of illness. Ones that are very sick, you really want to keep separate so that you can monitor them more closely. This is our current parvo room setup, which is so much better than anything we've ever had. It's really not a large room. It's kind of the size of a large walk-in closet, like 8 by 10-ish, I think. And what we have in here are 4 small cage banks that we have elevated up to waist high, which is great for me for cleaning and treatment purposes. And then 2 larger cage banks that can house like a 40 to 50-pound dog if needed. And we created those just because we do occasionally have adult dogs break with parvo. As you can see, we've got a prep table, cleaning supplies in this room. There is a mini fridge and microwave here that you can't really see. There's supply shelving and a closet for extra storage. And then something that I like that we did, because we were able to build this out as I wanted to, was we created an observation window in the hallway. So I don't have to actually go in there and gown up completely every time just to check on them. So in between like times when I'm going in there to do fluids, especially if I have a puppy that's fairly critical, I can just pop into that hallway, look through the observation window and see how they're doing. All right, symptom identification and testing. So what are the major first signs of parvovirus? Diarrhea, lethargy, vomiting, a little bit of blood in the stool, not eating, and not drinking. We deal with foster parents with puppies for the most part. I don't keep puppies here on site at HQ. I hate having them here. They're stinky, they make a lot of noise, they make a lot of mess, and they can't be on the ground here. So it's not good for them either, because they're basically stuck in a cage bank in our HQ until their foster comes to get them. So it's very important that our foster parents know the signs of what to look for and are able to communicate them very clearly. So this is our symptom communication protocol that they're given and that our case managers know. The case managers are like foster mentors that deal with each foster individually. So if the foster notices any of these things, what we ask from them is to collect the following information and give it to us. We need a picture of the stool. Reason for that is because foster's definition of diarrhea doesn't always meet my definition of diarrhea. How long have the symptoms been occurring? When was the last time they ate or drank? What are we feeding? Did something happen right before these issues started? Like, did they get into something in the yard or the chemical closet? Is the pet dehydrated? What do the gums look like? And then we check and see how the other litter mates are doing, both the ones in that foster home and ones that may be in a separate foster home. Obviously, if we have the same symptoms happening in multiple members of the litter, the chances of it being parvovirus go up. In the majority of cases, if a puppy has at least 2 of these symptoms, we are going to bring them in ASAP for a parvo test. That's sort of our threshold for when it becomes that emergent. They cannot wait to do that. We can't wait till the next day for a parvo test. The foster's like given a pretty clear directive that they need to be here as soon as possible for us to do that test. Obviously, before you bring the puppy in, you need to weigh your risk factors. So pets that are going to be at higher risk for parvovirus are going to be puppies under 4 months, especially if they've just come in within the last week. Your typical window for symptoms to appear after an animal has been exposed is between 4 and 10 days. So if you have a puppy that's been in care for 6 weeks, it's triple vaccinated, and it's been nowhere but the foster home that whole time, your chances of it actually being parvovirus are much less. In the majority of positive cases, we will treat all litter mates as exposed, and they have to be returned to us for treatment. We do not treat as positive until they are actually either testing positive or showing very specific signs of parvovirus. Reason for that is we've had in the past where we've treated everybody as positive. We've celebrated at day 4, yay, they're still eating, they didn't get it. We sent them back to foster, and then all of a sudden they have parvovirus. So we have adjusted our program accordingly. Our rule for foster homes that have had a positive puppy in them, if the foster has not quarantined those puppies in a bleachable space or a very specific space since they arrived at their whole home is quarantined for 3 months. So we do still let them foster adult, fully vaccinated dogs or cats or kittens, but they can't foster puppies for at least 3 months, with the understanding that they're also like doing a very extensive cleaning during those 3 months. Sorry, my dogs are going to bark at background here periodically. For testing, we use IDEXX snap tests. These are ordered through our vet approved IDEXX account. If you do not have the option for this, VetScan or Abaxis tests, you can order those on the internet, no vet required. They are fecal tests, they're not blood tests. They can be done by pretty much anyone. There's a swab, you stick it up the anus, roll it around, get a fecal sample, pop it into your test, and run it. It only takes about 10 minutes or so. Make sure that you're testing the animal directly, not just a pile of poop in the kennel, so that your results are accurate. This is what a positive IDEXX test looks like. So you have your control dot up top. That's going to pop up no matter what. And then if it's positive, you will have more dots. And typically those dots are going to be darker in color. So that positive dot is like very, very dark blue versus the control dot. Sometimes there's 3 dots, but most of the time you're just going to get these 2 dots here. All right, before we pop into the protocols specifically, just a few other things. So our exposure protocol, just had to throw this in here somewhere. So unless a positive puppy is a single puppy or it's been separated from its litter mates for more than 10 days, completely separated, we consider all the rest of the litter mates still at risk, even if they don't seem to be sick at that time. So asymptomatic litter mates, we isolate and quarantine until they have been completely away from that sick pet for at least 10 days. And our exposure protocol that they're going to receive during the time that they are being separated and monitored, we give them an injection of Convenia. That's a broad spectrum antibiotic that you will hear me talk about more in all of our other protocols. It's given at a dosage of 0.045 ml per pound, only once. B12 is, we use the injectable version in this, but you can also get it in tablet version. 0.5 ml is given once a day for 3 days. Polyflex is a broad spectrum penicillin that treats bacterial infections. And this is given at a dosage of 0.05 ml per pound twice a day for 3 days. We also use probiotics, lots of probiotics, while they're still healthy. And we also deworm extensively. One of the worst things that can happen is that you're also fighting secondary infections or parasites when you're trying to fight parvovirus. And each of those things makes the process much more likely to succeed. It's important to set expectations for yourself and for anybody else that's invested in this pet. Parvo is a 3 to 5 day illness. So when a foster brings me a puppy that's testing positive, I let them know right off the bat that I will not really have anything to tell them for at least 48 hours. The reason for that is because foster parents would like an update every 3 hours or every 6 hours. And I often don't have anything to tell them. So I just set that expectation right at the beginning. After 2 days, I'll probably be able to tell you something. And for your sake as the person treating, if you get the dog or the puppy on day 3 or 4 of its illness, just understand, be fair to yourself. The odds are against you. It doesn't matter what protocol you use. That's pretty far into a 3 to 5 day illness to receive the animal on day 3 or 4. If a dog presents with multiple ailments, such as kennel cough or coccidia, in addition to the parvo, the odds are now even more heavily against you, no matter what protocol you use. And don't hesitate to test and take action because you're worried about it being positive. I think there's a stigma associated with having parvo in your shelter or rescue. I certainly felt that early on. So we would be like, oh, let's just wait and see. It's probably not parvo. It can't be parvo. We don't want it to be parvo. And as a result, we probably started treatment too late. So I'd much rather waste the $15 on a test and have it be a negative test and give me peace of mind than wait because I just didn't want it to be parvo and I didn't want to have parvo in my rescue. Waiting even 6 hours sometimes can be the difference between that happy living and dying. What if they die? There are certainly no guarantees, even if you catch it early. We've had puppies that I'm pretty sure that we've caught in the first few hours of being sick that have still not made it. If you do enough parvo, some will absolutely die. That's the nature of this illness. However, they will absolutely die if you do nothing. Parvo is pretty much universally fatal if left untreated. Catching the illness early is going to be the most critical piece to your success. Make sure that you've educated your team and your fosters on what to look for, and do not wait to get that treatment started. And then on the other hand, know when to quit. If it's day 4 and you're, been doing heavy treatment and the puppy is still visibly worsening, there's no signs of improvement. If they're laying on their side, they're unable to stand. If they're bleeding out, like you pick them up and blood is just coming out of them, or if coming out of multiple orifices, that tends to happen at the end sometimes. Or it's just obviously dying. Probably most of you who've been doing rescue long enough kind of have a sense for when an animal's in its last few hours of life. Discontinue treatment and euthanize or let it pass on its own. Don't prolong the suffering just because, for your own personal self, your own ego and feelings. All right, yay, protocols. So you have a positive test, now what do you do? Like I mentioned, we've broken it down into 4 protocols. So protocol 1 will be no vet access, very little budget. Protocol 2, probably most of you have heard of this, is the Colorado protocol. It's the vet outpatient protocol. And then we have 2 protocols that we consider our gold standard. So one of those makes use of the new parvovirus monoclonal antibody and one does not. Protocol 1. So this protocol is when you have no access to vet care, you have very little budget, and this is basic supportive care. So it's better than doing nothing. And this protocol kind of forms the foundation for all the other protocols. So all the elements that you see in this protocol, we're going to repeat in the other protocols. Most important thing is fluids and hydration. Puppies can die from dehydration alone during this illness very quickly. So sub-Q fluids, lactated ringers, if you can get your hands on those at least, we give them at a rate of 10 mLs per pound every 6 to 8 hours. You can rehydrate orally, but it is not great. So you certainly would have a hard time getting the amount of fluids that you would need to give to a puppy via its mouth. And you're also fighting usually vomiting and nausea that way. If they are still eating, if their case is mild, you can add Pedialyte or Puppy Light to whatever available wet food you're using, and that just helps keep them hydrated as well. A fecal transplant, this could probably be a whole presentation on its own, but just very quickly, a fecal transplant as an idea is replacing the healthy bacteria that the pet has lost in the process of fighting parvovirus with healthy gut bacteria from an adult, fully vaccinated dog. So you're essentially taking healthy stool, mixing it with sub-Q or with sterile fluids, and inserting it into the anus of your parvo puppy. And that's just replacing the healthy bacteria that's been lost. I'm happy to talk more about this with anybody that's interested in learning more. But what you need to do this is going to be that solid stool, sterile fluids, a 10 ml syringe, a red rubber catheter. We use the 10 French size for this process, and some sort of small cup and stirring instrument. You mix 1 to 2 grams of fecal matter from your healthy dog with 10 mLs of sterile fluids. You want it to be as watery as possible with no chunks. Sometimes you have to use some kind of strainer. You certainly don't want a chunk to go through your catheter because it will blow back at you and then you'll get fecal matter in your face. Not a fun experience. So once you've mixed all that together, you drop back up into your syringe, put the red rubber catheter on the tip, insert the end into your puppy, and depress the plunger. I hold the puppy upside down for 30 to 60 seconds to make sure all the fluid gets where it needs to go, and that is a fecal transplant. What this does is helps decrease the length of time that puppy experiences diarrhea, and you can do this every 48 hours. Anti-nausea. So the biggest issue with not really using any prescription medications and also trying to do oral rehydration or syringe feeding is that you're going to be fighting nausea and vomiting. Two things that you can try if you don't have access to a vet. Pepto-Bismol can be given to dogs. That can be given at a rate of 1 teaspoon per 10 pounds of body weight and can be given 2 to 3 times a day. Pepsid or famotidine can be given at 0.5 mg per pound once a day. For a little bit of extra boost, B12, we use this in injectable form and multiple other protocols, but you can buy it at any grocery store in tablet form. The strength you want is the 500. And you can either pill your puppy or you can crush it up and add it to water or your syringe-fed food. Petinic is something that I've seen a lot of people use. I think it's just a general immune system boost. I don't use it, so I can't really give you any personal experience, but I have seen other people use it for this purpose. Cara syrup is a must-have. That's to keep your blood sugar up. We use that in every protocol and as part of the syringe feeding. Probiotics such as Fortiflora, Pedialyte, Puppylight, and then just making sure that you're deworming thoroughly. You can use Safeguard, which is a generic of Panicure. You can order that on Amazon, or Pyrantel can also be ordered on Amazon. And finally, with this protocol, syringe feeding, or the Parvo slop is what I like to call what I make to syringe feed with. Make sure that you've waited at least 20 minutes after administering whatever anti-nausea you're going to be using so that they don't vomit it back up. If they do vomit, just do not syringe feed. It's not worth it. But what I put in the Parvo slop is going to be warmed up Gerber beef baby food, warm chicken broth, Cara syrup, Fortiflora, puppy lights, canned puppy food, and just a little bit of B12 unless you've done it via pill. And you were just doing a very small amount. So the rate that I syringe feed is just 1 ml per pound of body weight every 6 to 8 hours when I go down there to give fluids. So I would advise against making like a huge amount of this at once because you want them to get the benefits from the things that you're putting in there. All right, that was protocol 1, basic supportive care. This is protocol 2, the Colorado protocol. This is an outpatient protocol, very common in veterinary care as well as shelters and rescues. Essentially what it is exactly what we just talked about. With protocol 1, sub-Q fluids and supportive care, but you are adding 2 very important medications. The first of which is Cerenia, that anti-nausea. That's given sub-Q at 0.045 mLs per pound, just once. You can give it once a day if you have access to it once a day, but if you've only got one vet visit, then you're just gonna get it once. Convenia is a broad-spectrum antibiotic, as I mentioned before, that is also given at a rate of 0.045 mLs per pound sub-Q. If you catch your Parvo on time and you are doing supportive care and you add these 2 things, your chance of survival goes up exponentially up to 80 or 90%, which is awesome. If your vet that you're using to do this has access to the monoclonal antibody, and I have found that because it's new, a lot of them don't carry it or they don't see a lot of Parvo, so it's not worth carrying it. But if they do have it, you should ask for it. It will give, in addition to the Convenia and Cerenia, will give your puppy the best chance of survival. All right, protocol 3, gold standard protocol. This is the version without the monoclonal, and it's the protocol we've used very successfully for the last 2+ years with the success rate of about 95% for ones that we catch on time. So a lot of this is going to look pretty familiar, right? First is lactated ringers or your sub-Q fluids, 10 ml per pound every 6 hours or so with a large gauge needle. Cerenia, the anti-nausea, 0.045 ml per pound. We could give that up to 4 or 5 days in a row, every 24 hours, or until the nausea and vomiting stops. Sometimes it stops after day 1, you won't have to use it again. Convenia is that broad-spectrum antibiotic, 0.045 ml per pound, just given once. And what's new in this protocol is going to be Baytril 100. This is a large animal strength of Baytril, but that's what we use here in this protocol. So it's 100 milligrams per milliliter. That is given at a rate of 0.05 ml per pound once a day for 4 to 5 days. Of course, we're deworming through still the whole time. Panicure once a day for 5 days. Reglan is part of an anti-nausea as well, so it helps prevent reflux and keeps everything going in the direction you want it to go. We give that twice a day at a rate of 0.05 mLs per pound for 4 or 5 days. Polyflex or ampicillin, that's that broad spectrum penicillin that treats bacterial infections. That is also given twice a day at a rate of 0.05 ml per pound. And then we do give the injectable version of B12 once a day for 3 days at 0.5 mLs per pound. And we do all of these medications through the fluid line. So you're not poking your puppy 10 times every time you go down there to give medications. You're using the port on the fluid line. That also helps make sure that the couple of medications that burn, which will be Serenia and Polyflex, don't burn as bad because they're going right into a fluid bubble. This is my med chart, which makes sense to me, but may not make sense to anybody else. I don't know. So feel free to make your own. But the whited out spaces are ones where you do give the medication. And if they're blacked out, you don't give the medication. And this just helps me keep track of what I have already given and what we're giving, what gets given once a day versus twice a day. Plenty of space on the side to keep notes. Et cetera. But like I said, it's mostly just me doing Parvo. So these are like notes for myself. You may need something a little bit more comprehensive if you've got multiple people involved. And then just reminders at the bottom about the sub-Q fluids, about how much to syringe feed, and then giving all the medications through the fluid line. Some of the common complications that I see frequently, and then some potential solutions. So if you have a puppy or a dog that's not responding to Serenia, they're continuing to vomit multiple days in a row despite daily administration. If they've got very viscous, thick drool coming out, in my experience, this is a bad sign. Most of the puppies that do not respond to medications over the course of multiple days with the vomiting and the drooling do not make it. I am not a scientist and don't quite understand why, and it frustrates me every time. So I can't give you an exact reason why this happens, just that it does happen and it's hard to combat. Some of the things that I do try with to combat this problem are going to be Zofran. That's given at a rate of 0.05 mg per pound twice a day. And you could also try the famotidine and Pepcid as well. If the animal also has kennel cough, we've seen a lot of that this year. In theory, the Baytril should be combating the kennel cough, but my experience is that it does not. So I add doxycycline in the oral version, 0.05 mg per pound twice a day. If they also have coccidia, we use toltrazuril to treat coccidia for both kittens or cats and dogs. And that's given at 0.2 mLs per pound once a day for at least 5 days. And then finally, just kind of an observation, more output is not a good sign. So I'd much rather have a puppy that is not vomiting and does not produce any stool for 3 to 4 days. That's not concerning to me at all. But puppies that I go down there every 6 hours and they've had like multiple diarrhea or blood blowouts are much harder to work with, and their chance of success is much less. Something to know. All right, last protocol will be our gold standard protocol plus the monoclonal, and I will discuss that briefly in case you're unfamiliar. So the Elanco Canine Parvovirus Monoclonal Antibody, they're calling it CPMA, which is way easier to say. So what is it? It is the first antibody treatment that specifically targets parvovirus. So all the other medications that we're using in the other protocols are helping to support the overall state of the puppy, the system, but they are not specifically going after that parvovirus. And this is, which is cool. It is new. It became more broadly available as of December of last year. We've been using it pretty extensively since then. The benefits that Elanco says it has, it is a targeted medication requiring only 1 dose. It reduces labor and time spent providing care to your sick puppies. It reduces recovery time with proven faster resolution of vomiting, lethargy, and inappetence. And it reduces your necessary post-symptom quarantine time, which is cool too. And 0 dogs that they treated with it during their trial died. Our experience with it has been sort of middling. It does indeed decrease recovery time. It decreases your overall labor time, both daily and in terms of the whole grand scheme of the treatment window. It has absolutely saved a few dogs and puppies that would not have lived with our normal standard protocol. However, we have had dogs and puppies treated with CPMA die, and I know other rescues have as well. I do not understand really what the discrepancy is between what we're seeing in real life and what they had experienced in their trial. I wish that they had expanded their trial a bit to include what we were seeing in rescue world, but they have not at this point. So I'm considering it a good tool in our arsenal. I don't consider it the be all and end all of parvo treatment at this time, but I do like it and I do use it. Something to know too is that it is expensive. It is $200 per vial base cost, and each vial only treats 10 pounds of body weight. So if you've got a 20-pound dog, you're talking about 2 vials or $400. But like I said, we do use it. We've used it for the majority of puppies that have come in this year, unless they're very mild when they arrive. I think when we first started, our plan was, and I think this is still a valid plan, to use it if they don't seem to be responding to our normal treatment within day 2.5, then we would add the monoclonal as a tertiary option. I still think that's a fine plan if you want to do that. We do also use it for dogs under 30 pounds who are not tolerant of typical treatment. So for example, we had a dog a few weeks ago, came from Washington County, who was under socialized and did not particularly care to be handled. And as I'm usually treating parvo by myself, I have a hard time treating dogs who are like bucking and biting at me while I'm trying to give them fluids. So we did end up giving the monoclonal to her, even though she was larger than I would have liked to give this to. And she did live, which is awesome. And she really didn't get anything else except for the monoclonal. So that's a good testament to its efficacy. I use it when I know that my time is limited over the next few days. We like to joke that the puppies like to break with parvo on a Thursday. I am not at the rescue on Fridays because I'm at Maryland for our spay-neuter day. So almost always it's a Thursday that puppies break with parvo. So in that case, we always give the monoclonal because I know that I'm not going to be able to be there every 6 hours on the dot to give that more intensive treatment. Certainly, if I were a rescue that was doing pure outpatient or the Colorado protocol, I would use this, hands down. We do not use it for animals over 30 pounds. As a rescue, we've just decided that this is cost prohibitive and we will not do it. And we don't use it for dogs who are too far gone on arrival. So this doesn't mean that just dogs that look bad, because that happens all the time and they still live, but dogs that you can look at and know that that one's going to be gone, within the next 2 to 6 hours. This is not like a last-ditch life-saving tool, and it's a waste of resources to use that on a pup that's not going to make it. Here's what the protocol actually looks like. Very familiar at this point. So we use that monoclonal. It's given at a dosage of 1 vial per 10 pounds of body weight. And this is given IV. This is the only thing that we give IV. Everything else I give sub-Q. Convenia, Serenia, B12, your sub-Q fluids, the Polyflex, and other things that you can add in, but that we have eliminated as like a standard as part of the protocol. So we've taken out the Reglan and the Zofran, and we've taken out the Baytril. You can add these things back in later if they don't seem to be responding or your medical team thinks they need them, but this is not part of this protocol. Other stuff that you can do, obviously your standard supportive care, Panicure, penicillin G. I haven't mentioned that before, but I do use it periodically for parvo puppies, and then the fecal transplant and the syringe feeding. All right, we're nearing the end. Tricks and tips, things that I basically just couldn't fit in anywhere else in this. So things to know while you're treating. I don't leave wet food out for the first 48 hours or so. They're not going to eat it anyway. It's a waste of materials. But I do leave out water and dry food all the time, no matter what stage of illness they're in. There's usually a few hours or a day when you will know that they're going to turn the corner and they start to show interest in food again. Once they do that, you do need to offer them a variety of foods. I used to make a thing called the Parvo platter. We'd have like 6 different food options in one little box. Because you just don't know what they're going to like. Most of the time they pick one thing that they will eat, and until you find that one thing, they just will not eat anything at all. So things that I've had good success with, deli meats, so deli turkey or deli ham. Normally they don't like both, they just want one. Warmed up Gerber beef baby food is great. The little Rachel Ray dishes with the meatballs, for some reason, they seem to like lately. hot dogs, dried liver bits, and a random assortment of chews and treats. One time we had like 2 puppies who would only eat these dried sweet potato treats, and that lasted like 4 days. And I didn't care because at least they were eating something. But until we tried that, they weren't eating anything at all. I play music in my parvo room. They really shouldn't have litter mates to interact with, and you as the handler shouldn't be in there like coddling them and loving on them nonstop. So something that keeps them sort of grounded in reality while they're just laying there sick for a few days is a good idea, whether it's music or TV. Don't worry about messy. Parvo is messy. The puppies are going to be gross at the end. Of course, I keep their space as clean as possible. I'm changing the linens. I'm cleaning out their space every time that it needs it, which is usually every time I go down there for fluids every 6 to 8 hours. But I don't usually bathe them until they're done. And in the clear, I like to say that alive is better than clean. And you don't want to cause a problem like a URI or mess with their body temperature. And if you're treating parvo and you don't know, you need to develop a strong stomach, especially when it's very severe or you're nearing the end. There are lots of bad smells. There's blood explosions, vomit, worms, more body fluids than you could identify or that you knew existed. This just is how it is when you're treating parvo. All right, so how do you know when they're getting better and what do you do after? So if they're going to make it, most of the time they're going to show improvement within 4 days. I used to say that at the end of day 4, they're either going to be dead or they're going to be showing some signs of improvement. And this is a good rule of thumb. It's not 100% accurate all the time, but it's just a good standard to go by. In almost all cases, when a puppy starts eating on its own again, you can assume that they will recover. I've only had a couple of exceptions to this, and all of them had to do with secondary infections that the puppy was also fighting. So about 2 months ago, we had a litter come in that had very bad pneumonia in addition to the parvovirus. We did beat the parvovirus, but the puppy started eating again. And then I would say about a week later, he did end up passing, but it was because of complications from the pneumonia, or the 2 things combined, but not specifically from the parvo. But that's a huge outlier. So, when I see a puppy eating again on its own, it's time for celebration. They're probably going to make it. Our standard for post-parvo is 10 days of post-parvo quarantine prior to whatever is next for them, whether it's the next round of vaccines, spay neuter, adoption, or re-entry into the general population. We do start that 10-day count when your major symptoms subside and the puppy starts eating on its own. We have not changed this rule, even for the ones that we use the monoclonal on, even though the monoclonal is supposed to decrease the amount of shedding time. I don't know exactly what the number is on that, so we just haven't changed the rule out of an abundance of caution. But we have never had a problem with this 10-day rule. We are not retesting. We're just calling it 10 days and good. Never had an issue. I will say, though, that we do vaccinate puppies every 2 weeks from the age of 4 weeks to the age of 4 months up until the time that they're adopted. We don't put them on the ground at our HQ or at any of our adoption events or anything like that. And this does not change either, even if they've had parvo. So we don't have like a 7-week-old puppy that survived parvo on the ground still. It's just that vaccination process covers much more than just parvo. All right, so yay, in conclusion, find a protocol that works for you based on your available resources. Please do not be discouraged when animals don't make it. This is a very tricky illness with way too many variables to cover, even in the best situations. And certainly if we had let the losses outweigh our successes over time, we would not have continued to treat parvo, and there would be hundreds of dogs that would not be alive today. So know that your efforts matter, whether you save 1 or 100. The end. All right. Thank you for listening to me ramble about parvo. Does anybody have any questions or anything? Diana, do you want to say anything? Stephanie.
Hey, Ryan, that was great. Thank you so much. Trying to unraise my hand. So I noticed, I thought it's on some of your pictures, I thought I had seen some IV sets. So I was thinking you gave IV fluids, which seems like it would be pretty, challenging to do on your own and whatnot. But you have pretty good, it looks like the sub-Q fluids are working really well.
Yeah, I would say, I mean, we use like in the process of giving the monoclonal when we give it, since we have an IV in at that time, we usually pump them with IV fluids at that particular moment. But I usually just run like a sub-Q or like, a fluid bag with the line, but I give everything sub-Q for the rest of the treatment. And we've had no problems with that.
Okay, cool. You guys do an amazing job. That's just an amazing, because it's, I mean, the cost of treatment is usually, results in euthanasia. So
Right.
it's amazing. That's really cool to know that you can do that. Thanks for sharing.
Thank you. Yeah, of course. Anybody else have anything they want to know more about?
All right, so we're all going to go out and start our own in-home parvo treatment wards. Yay.
I hope so, because I need help, y'all. I can't do all this myself.
There was a question in the chat about a copy of the presentation. The recording will be posted on our YouTube channel, which you can access in the header of our website. All of our presentations, or most of our presentations, are posted on that within a few days after the webinar.
And I'm happy to email it to anybody if you want copies of the slides too, if that's fine. This is my email address here on the screen. So.
Thank you so much, Ryan. That was wonderful. A lot of good information.
No problem. Thank you so much for giving me a platform to do it. I'm happy to share.
Anyone else have any questions before we end? All righty. Going once. Thank you. You'll have a good
Thank
evening.
you guys.